14. Oh my gosh, that was really quick. Sorry, oh my God, because I feel like I'm done. Okay, cool. I'll try an outro. Hello, my name's Nicole James. I'm a cosmetic or aesthetics doctor, and today I want to talk about how to get into cosmetic or aesthetics medicine. This is something that I get asked all the time, so I just wanted to talk to you about all the different ways you can get into it, the pros and the cons, and just considerations in general. So before you embark on your journey into cosmetic or aesthetic medicine, you first need to make sure that it's right for you. Cosmetic medicine is a really unregulated specialty, so that means that there's not going to be the same procedures and processes to getting into aesthetic medicine as there would in other specialties. For example, things like medical specialties where you go through a specific training pathway. We don't have that. So it's quite specific and nuanced of the things that you have to do. So when you think about getting into aesthetic medicine, you have to make sure that you're happy with it being a bit more unregulated and not having such a specific path. There are many pros to getting into aesthetic medicine. For example, if you're into the beauty industry and you really like making your patients feel and look good, then this is really something that could be great for you. Other great things with aesthetic medicine is you get to learn how to run a business if you start your own clinic, which can be really attractive to some people. Another great thing about aesthetic medicine is it's a bit more private, so you get to work in private clinics. It's not actually set in the hospital, so some people quite like that. And one of the best things for me about aesthetic medicine is there's no night shifts, there's no on-calls. It's very 9-to-5 based. You might have to work some weekends, but some people quite like that and it works for some people. And another great aspect of aesthetic medicine is that you can actually do it alongside your current training pathway. A lot of people do that. They'll have their medical or surgical specialty, and on the weekends, to earn a bit of extra money, they will do aesthetic medicine in a clinic. So that can really work for a lot of people as well. And further on from that, you can use aesthetic medicine to complement and earn a little bit of extra money. It's a very lucrative specialty when used in the right way. So those would be the general pros to aesthetic medicine, and to be honest, I could keep going on forever about the pros. You have to be mindful that there are some cons to aesthetic medicine that not a lot of people talk about and isn't really discussed openly in the industry, in my opinion. So these are some of the pros that I think apply to aesthetic medicine. Like I've said before, it is very unregulated, so you won't have a more senior consultant in some cases making decisions for you. You're very much going to have to rely on your own training and specialty that you've done and your own reading. So that's something to bear in mind. If you're someone who likes to have a lot of senior support, then it might not be for you. Equally, if there's any side effects that happen with procedures that you carry out, it is you who's going to have to deal with that, and you're going to be responsible for each patient that you see. And the buck stops with you, really. So if that's something that makes you a little bit uncomfortable, then maybe have a long think about getting into aesthetic medicine. The other very slight con, I would say, is you have to apply for jobs if you don't want to start your own business and you want to be in a clinic. It's not a massive deal, but it can be an area of stress and uncertainty for a lot of people who want to get into aesthetic medicine. So those are the main pros and cons. Now you've figured out that aesthetic medicine is right for you and you want to pursue this career path, then how can you get into it? So there are a couple of ways that you can get into aesthetic medicine, and I want to just go through these quickly so you understand exactly how to get into this career. So the first way is doing a course. To be honest, this is really the only way to get into aesthetic medicine because it is so unregulated. You have to do a course, and unfortunately these courses do cost money. Now, the amount of money that these courses cost can range anywhere from £10,000 to £1,000, maybe a little bit lower if you're lucky. So you have to decide which course is right for you. So how do you go about choosing a course? Courses that you can purchase range from a diploma, a level 7 diploma, to a foundation, Botox and filler course. So the foundation, Botox and filler courses are very, very basic. They usually start at 1 day and around £800 to £1,000, and you'll learn very, very basics of Botox and filler. The next step up would be an advanced Botox and fillers course, which range anywhere from £800 to £2,000. I think these are a really good option if you're just starting out and you're not really sure if you want to pursue medical aesthetics as a long-term career, or if you just want to use aesthetics to use alongside your current career. For example, if you are in the medical or surgical field and you just want a Saturday doing Botox and fillers to supplement your income. And the other course is a level 7 diploma, which takes anywhere from 6 to 18 months to complete and ranges from around £5,000 to £10,000. Now, when you're looking at a course, especially on the lower end, you want to make sure you find a course where you get one-on-one trainer and mentor supervision, and you get a model to yourself. So you don't want to be going on a course where you're sharing models with all the other delegates. You want to have your own model to practice on to make sure that you're learning effectively and really honing your techniques. The other things you can look for, which will supplement the course, is having a mentor who will help you throughout your journey in aesthetics. Some courses do offer that. Unfortunately, there will be a higher price point. So what do I recommend in terms of the course you should go for? In my opinion, you can start with the advanced Botox and fillers course and be able to practice off of that. It's a much cheaper option compared to the level 7, but it's not the basic, so you'll get a little bit more opportunity to practice and you'll feel a little bit more confident. So those would be my recommendations in terms of which course to choose. So now you've done your course and you feel ready to go, the first most important thing you need to do is get insurance. There are loads of insurance bodies. I would recommend finding an insurance body that represents medical professionals because they are very specialist in what we do and they'll know the nuances with medical aesthetics and how it works. It's very important to note that your normal insurance is not going to cover you. Your normal indemnity that you use when you're in the hospital or in the GP, it's not going to cut it. You need a whole separate insurance. Unfortunately, the insurance does cost about £500 for the whole year, although some of them do offer payment plans month by month. So make sure to factor that in when you're thinking about how much this is all going to cost you upfront. So now you've got your insurance and you're ready to go. You're now a fully qualified cosmetic doctor or aesthetics doctor, which is great. So how do you start practicing? I would personally advocate for anyone who's done the course to start practicing right away. If you don't use the skills, you're going to lose them. So get practicing as soon as possible. But to do that, you're going to need to get a job or you're going to need to set up your own business. Both are great options and both have pros and cons. If you go into a clinic, you can go in a couple of days a week, especially if you have another job alongside as well. That can be a really good option. You'll have to apply to a clinic and try and get a job that way. Some clinics will advertise that they need aesthetic doctors, But sometimes what I find is a really good option is just to email local clinics around you and see if they need any help. And that can be a great way to start. Of course, this offers a bit more support if you don't feel very confident at the start. You'll have experts around you in case anything goes wrong, and you'll feel a little bit more comfortable. But there isn't as much autonomy if you were to do something like start your own business and go at it yourself. So the option of starting your own business can be really scary, but really exciting. And it's a great option that offers a lot of flexibility for aesthetic doctors like myself. So you can go and approach different clinics around you and ask to rent a room. It will be a flat fee, and you'll rent the room for a day or a couple of days and bring clients into that premises and that space. You can opt for a place that already does Botox and fillers, so they'll have the stock on hand. A lot of places will be more than happy to provide you with the stock and take a percentage cut of anything that you earn. Or some places will prefer for you to just pay a flat fee and buy all of the stock yourself. Both are absolutely fine. It's just what you prefer to do. Of course, one is going to have higher startup costs for yourself. If you are going to go down the route of starting your own business, it can be absolutely fantastic, but you just have to know that it comes with a lot more upfront costs than going into a clinic a couple of days a week. You also have to market yourself, which is something that's really strange to a lot of us medics. It's not something we're trained in. I'd recommend marketing yourself through social media. That can be a great free way to gain clients. So that is one of the biggest hurdles that you might find. But some clinics will offer to only let you pay per client, and that can be a great way once you're starting to build your client base. So whatever option you go for with becoming an aesthetics doctor, there's loads of great options. Like I said, it's really important to first make sure that it is right for you. Again, I'd recommend going and doing a lot of research into which course you want to do. And I'd also recommend completing your F1 and F2 before you embark on this journey to make sure that you've got your full GMC registration. Thank you so much for watching. I hope this was helpful to anyone who's trying to get into aesthetic or cosmetic medicine, and thank you so much.